with delaying elections. This is simply looking at a practical level of going back to 4 yearly elections, which we would have done had we known about LGR. The savings cost is minimal. It isn't about that. And we've had elections. If anybody chose to look, and I've forgotten the date now, it just eludes me, but I think we've pretty much had elections for the last 10 years, every year of one form or another. And it takes not just finances, but it takes a huge logistical organisation to hold those elections. That said, you know, for those councils that are perhaps going to be serving, or councillors that will be serving a 7-year term without election, that is a very different kettle of fish. And I think, you know, what we need to be clear about is actually remembering that we're in a fairly unique position here in Cheltenham. And, you know, I'll do what's right for Cheltenham and its residents, because, as I've mentioned, the unwelcome LGR has a cost to it that the government has said you'll do it, but we're not going to give you any money. So we've got to find anywhere between £1 and £2 million to pay for the transformation and transition to unitary authority. So I thought it was quite important that I put that out there to members this time. I'm also here tonight, Chair, because actually no, it's not. That doesn't matter. Sorry, I forget that comment. But there isn't really anything else for me to update on. But I'm very happy to take questions.
Thank you so much. We really appreciate having updates on that. I believe you said you'd written to the government about postponement. Do you know when you might expect to get a response about that?
No. The government will respond in due course.
Okay, thank you so much. I appreciate that.
I don't expect the response in terms of whether or not they were prepared to approve it to be probably, they will have to do it before the end of February. So it has to be 6 weeks before any election is due to be called. Okay. So I would expect to hear in February, if not before. It would be nice if we knew before.
Okay, perfect. Thank you so much for clarifying that. Do any members here have any questions in relation to Councillor Hayes' update? Cool. Councillor Chellan, yeah, go ahead.
It's just something that a lot of my residents keep asking about, and that's the sale of this building and how that's going.
That is still on track and moving forward.
Thank you so much. Are there any further questions? All good? Okay, perfect. Thank you so much for your time today. I really appreciate it. And it's really good having clarification about everything going on. So yeah, that sounds really good. Is there anything further you'd like to add just to sign off, or are you fairly happy? I don't know if Councillor...
Sorry, I didn't hear that.
Just was there any final statements you'd like to make? Otherwise, we can wrap up and move to the next item.
Thank you, Chair. I'll just update on the budget, I suppose, but you've got the papers in your packs. Just to outline some of the steps prior to you receiving that paperwork. I don't know if members are aware that we delayed the budget consultation. The government moved their timeline for our settlement, and the advice we were receiving was quite. There was quite a big differential in the advice we were receiving as to what that settlement might be. So it was prudent, I think, to delay that to try and get as much certainty around our figures as possible. That does have a little bit of a knock-on effect in terms of having to do a lot of extra work at the last minute. And even though it was a 3-year settlement, it was not what I was expecting. But I think across the country, I think it's a clear signal where the government views local authorities at district level. So I've met with Budget Scrutiny Working Group. There are other budget consultation events happening with parish council and so forth. And obviously here this evening as well, Chair. So I welcome any comments later on that item. Thank you.
Thank you so much. I really appreciate that. So did you want to stay for, because I think Councillor Bamford is giving a presentation on the Budget Scrutiny Working Group. Did you want to stay to commentate on that? Okay. Councillor Have, if you'd like to, if you need to move on to do anything else this evening, then you're very much free to go. But if Councillor Jeffries is okay to stay, I think that could be appreciated. Thank you so much. I really appreciate that. Okay, so moving on to the item 6 on our agenda is our enforcement of the sexual entertainment venue policy. So our objective with this one is to understand, following our review recently of the sexual entertainment policy, how matters falling underneath it are enforced. So enforcement is very much key to the discussion tonight. Please, if possible, try to stay sort of mostly targeted on our enforcement and about how we can actually regulate what policy we actually have in place. There's only so much time we have, because I'm sure you're all aware that SEVs is actually a very, very broad subject, and we could easily talk about it for hours. So Michelle Bignell has kindly joined us tonight, and I'd really like to welcome her as our Licensing and Public Protection Manager. And I really appreciate all of the work that you do in many, many different avenues to kind of keep things going smoothly. If you would like to address the committee just with whatever is pertinent to SEV enforcement policy at this time, I'd really like to welcome you to our committee. Thank you.
Thank you, Chair. So the committee have asked that a briefing paper is prepared to understand the enforcement and compliance work that we do around sexual entertainment venues, and that has been circulated. So just a bit of a background, the Council approved the adoption of the Local Government Miscellaneous Provisions Act 1982, Schedule 3, on the 1st of December 2010. Since the adoption, any premises that want to offer relevant entertainment on a frequent basis can only do so by obtaining a sexual entertainment venue licence. Relevant entertainment is defined as any live performance or any live display of nudity, which is of such a nature that, ignoring financial gain, it must reasonably be assumed to be provided solely or principally for the purpose of sexually stimulating any member of the audience, whether by verbal or other means. Under the Act, premises can also provide relevant entertainment on an infrequent basis without the need for a SEV licence. An infrequent basis is defined under the Act as no relevant entertainment has been provided on more than 11 occasions within a 12-month period, and no such occasion has begun within a period of 1 month beginning with the end of the previous occasion, and no such occasion has lasted longer than 24 hours. Our current policy was adopted in July 2020, and this outlines the standard conditions that are applied to all licensed venues. These conditions cannot be imposed on a premises utilising the infrequency exemption. We currently have 2 licensed premises, and that is for Under the Prom on the Promenade and Mr Cambray's on Cambray Place. The hours that they're licensed for are outlined in your briefing paper. Although licensed for those hours, those premises do not operate to the extent of those hours. Currently, both of them operate in March Festival, and Under the Prom operates over the November race meet. Both premises have applied to amend 2 standard conditions, and they have been subject to a consultation with the police and a 28-day public consultation. Both licences are renewed annually, and due to public objections that we usually receive, are subject to a licensing subcommittee determination. I have outlined in my report that the operators of both of the licensed venues work closely with the licensing authority and the police. We have regular communication with them. They attend the night safe meetings, and they engage with the police briefings held on the evenings of race days. Both premises have been open to visits from members of the licensing committee so that it can observe the setup of the premises and talk to performers about the work that they do and ensure that they feel safe. The operators have also signed up to a voluntary code of practice which goes over and beyond our standard conditions, and you can see those. You can see the code of practice in Appendix 2 of our policy. When the premises are open, we carry out compliance checks, and we do proactive work over the period with the police. What we do is we go around the venues and we do a thorough inspection of all paperwork. We look at the CCTV, we observe the booths and the performers. We are usually accompanied with the police licensing officer, but over the last race meet, that position was vacant. However, our police licensing officer has just started this week, so we do have that position filled now. The unlicensed premises that we've had have operated at 2 venues in the town centre. We have worked with those venues and outlined what the standard conditions are and to educate them on that. The operators are open to notifying us when they are open, and then we do update the police so that we're aware that those premises are open and using the infrequency exemption. It has been observed by both officers and members the stark differences between the 2 types of venues. These include cash payments instead of being paid by cheque, tariffs agreed directly with the performer rather than a tariff which is the same for all, and touching has been witnessed alongside lack of CCTV coverage and SAA presence. Obviously, all of those concerns jeopardise safety of the performers. Whilst we have enforcement powers over the licensed venues and can ensure that the premises are run safely, we have no powers over the unlicensed venues. Any breaches of the licensed venues may result in enforcement action, and that would be carried out in line with our corporate enforcement policy, and I put a link to that in the briefing paper. Since writing the briefing paper, there has been a publication from the government, and that has been tied to a violence against women and girls strategy. As part of the accompanying action plan, it's committed to examining whether the licensing regime for sexual entertainment venues should be amended to prevent sexual exploitation in the nighttime economy and during festivals and sporting events. So this is really positive and great, a great move forward, and it just shows that the hard work and lobbying that Cheltenham Borough Council have done with the government has actually been listened to. So obviously we're really positive about that and how that will move forward. Thank you, Chair.
Thank you so much. I really appreciate your overview for that one. Just double checking, you mentioned in item 7 about SIA presence. Could you just clarify for us what that means, please?
Thank you, Chair. SIA is Security Industry Authority. So to be a door staff, door supervisor on a licensed premises, you must hold a badge and be accredited by the Security Industry Authority.
Thanks so much. I really appreciate that. So we've had a couple of questions asked ahead of time. I just want to check with the committee members. So I believe it was from Harry and from Councillor Chellin. Would Mr. Bougie or Councillor Chellin, are you fairly happy with the answers you've received? Do you have any follow-ups you'd like to make? Perfect. Go ahead.
Yeah, thank you for answering them. And my question was, so I get the distinction between the licensed and unlicensed, but how do you monitor those institutions that don't have the license? Is it wholly dependent on them voluntarily coming forward and saying this is what's happening, or is there any other way to basically check in on them that they're doing it because they don't have that formal relationship with you?
Thank you, Chair. So with the unlicensed venues, we don't have the power of entry. However, they do work with us, which means that we can go around with the police officer and not inspect the premises, but observe what's going on in the premises. And we can give feedback after the event. But when it comes to, obviously, our standard conditions of the policy, they don't have to adhere to those.
Councillor Chellin, thank you so much.
Actually, that just leads me to ask then, you know, when you do feedback or when you see what's happening at the unlicensed venues and you do feedback, to what extent do they take on that feedback? Have you seen improvements?
Thank you, Chair. So personally, I've been here for 1 year, so I've seen the unlicensed venues on one occasion and we have fed back the feedback. They haven't operated since then. So obviously, if they operate in the upcoming March Festival, then we would hope that they have taken that feedback on board.
Thank you so much. Is there any other member questions? Councillor Horwood, were you raising your hand, and Councillor Clamp?
Yeah, so a couple of questions. First of all, what sort of timescale is the government's review on, and what sort of prospect do you think there is for a change in the law that would give us slightly more power over all sexual entertainment venues? Secondly, how many unlicensed ones are we aware of? And then thirdly, one of the rationales that the licensing committee gave for, and in fact the policy cabinet when they developed the policy was, or proposed the policy, was to safeguard the welfare and the safety of the performers in particular, because obviously they, as you've said, are more at risk in an unlicensed environment. Do we systematically contact performers? And because you've talked about engaging with the venues, but you haven't specifically talked very much about sort of systematically engaging with performers who might be most at risk in this situation.
Thank you, Chair. I'm just having a look at the government paper at the moment. It's probably best if I circulate the link to that, if that's okay, and then you can see the overview of the government paper. With regards to performers, we do speak to the performers at the licensed premises, and they also come along and support the applications because they feel safe in their working environment. In terms of the unlicensed venues, we do obviously public consultations, and it's open to all to feedback on.
And the question about how many of those unlicensed ones we're aware of?
Thank you, Chair. Only the two, and that's the ones that operated in March Festival last year.
Thank you so much. Councillor Clapp, did you have a question?
Just a quick one regarding the licensing police officer. So, as stated, obviously vacant position since April 2025. So my question is more around, during that time period, was their presence kind of really noticeable with the team, and were any kind of frameworks put in place to ensure that their usual input was sought elsewhere, or anything they might do? And kind of going forward, because the position's been vacant for quite a long time, is there some kind of plan to ensure that they're properly caught up from our side, but also any suggestions or additional work that might not have been carried out for that to be picked up to ensure that, you know, we're fully compliant?
Thank you, Chair. Is that in terms of sexual entertainment venues, or is that in terms of broader licensing work?
With the sexual entertainment venues.
Thank you, Chair. Yes, so in November we couldn't inspect the premises with a police officer. So yes, we were obviously short of that competence and expertise. However, we do have obviously competent licensing officers that still carried out the inspections. Going forward, we will be working closely with the police alcohol licensing officer, and he will be trained with the National Police College of Policing, so he will understand the requirements of ANSEVs, and obviously we'll have full briefings before the events as well.
Do you have any? Oh, Councillor Day, go ahead.
Thanks. Just a couple of probably quite quick questions. So I guess because unlicensed premises are unlicensed, that's why CBC can't take action. But could you say, is there anybody who can take action, who has the right to inspect those premises and take action if they see anything, you know, that they're not happy with? And the second question is, in setting the conditions for a licensed premises, how much latitude do we have as a council to set those conditions? I mean, for example, do they all need to be, is it possible to cross-refer them to national, you know, legislation? So do we have to operate within a national legislation framework, or do we have much latitude, you know, to say in Cheltenham, these are the things you can and can't do? Thank you.
Thank you, Chair. In terms of the unlicensed venues, that is the whole point of that. Unlicensed, there's no way that we can enforce. There's no one else that can enforce. Obviously, if there was any sexual offence take place, then the performer or audience or whoever could report that to the police. In terms of the conditions, they can be locally set. There is also the Home Office guidance as well that we can follow. Thank you.
Amazing. Thank you so much. Do we have any further questions or anything? Thank you so much, Councillor Challen.
To what extent is the sort of promotion and the advertising of the venues limited? It's just, you know, just sort of loads and loads of flyers and people accosting. residents during the races, and I just wondered, how much of that is allowed.
Thank you, Chair. So there are the standard conditions around the banners on the premises, etc. The distribution of printed matter is a separate legislation. So that's the distribution of free printed matter, which we are also responsible for. But we'd obviously take concerns away from this meeting. Thank you.
Thank you so much. How are people feeling? Do you have any further questions that you'd like to ask? Okay. Presumably, if there's anything else that we'd like to raise in relation to this, we can contact you and your team as well. So just check in about that. Of course, yeah.
Thank you, Chair. I have just I just update you on the evening nighttime economy work that we're doing at the moment. So the Purple Flag Working Group, we are reviewing our strategy, and as part of that, we would like to introduce a charter that licensed premises sign up to. So obviously, the two venues that operate are also licensed premises. So we would obviously encourage them to sign up to that charter. That would cover lots of safety initiatives, including Ask for Angela, Ask for Clive. So I don't know if you've just seen a press release that's gone out today. So we carried out a test purchase operation on Saturday, and it was 100% success rate. So that's really positive. Thank you.
Are you in a position to take any further questions about like purple flag status or the charter? If people, amazing. Does anyone have any further clarification points to make about that? Yeah, Councillor Horwood.
Sorry, I do just want to come back to my question about the number of premises, because you just mentioned 2 premises, but in answer to my question about how many unlicensed ones there were, you said 2. But did you mean 4 in total? Yes. Okay, so we're talking about 4 premises, depending on how many unlicensed ones pop up, are we?
Thank you, Chair. So we have 2 licensed venues, and there were 2 unlicensed venues, so 4 in total.
So I guess we could say from that we have a 50% uptake on licensing for like suitable venues for that operate within the parameters of the government's like licensing agreement, I guess, because there are certain criteria you have to meet in order to be eligible, I think, as sorry, I feel like I'm waffling a bit, but thank you for clarifying that. I appreciate that. Are we fairly happy with that discussion? Is there anything else that people would like to ask? Is there anything else you'd like to bring to us to make us aware of? Okay, well, I'm fairly happy to close that discussion if we're all good with that. So thank you so much for joining us today. I really appreciate it. Okay, perfect. So we don't have to make a decision on this. If there are any recommendations people would like to make based on this, I don't want to put you on the spot tonight, but like we can always raise that as further discussion, or we can like gather recommendations or sort of feedback in relation to that. And thank you again so much for your time. I appreciate it. So moving on to item 7, feedback from other scrutiny meetings attended. It's useful for us to have a holistic awareness about other things that are going on routinely within our sphere of awareness. So we work with Gloucestershire Police and Crime Panel and the Gloucestershire Economic Strategy Scrutiny Committee. We have 2 councillors, Councillor Atherstone, who works with the Gloucestershire Police and Crime Panel. She has provided an update from the meeting that met on the 25th of November. So this is has been published as a supplement, which you should have received. And Councillor Orme unfortunately wasn't able to attend the November meeting of the Gloucestershire Economic Strategy Scrutiny Committee. But if you would like to consider his minutes as well, the minutes that were published for that meeting, then we very much value any feedback or questions that you would like to pass on to those committees. And it's really valuable to have your insights about it if that's something that you have an interest in. So we have tonight Councillor Bamford in attendance, who's actually both provided a review of the meeting of the HOSC on the 14th of October. He's in, I don't know, would you, Councillor Bamford, if you might be in a position to provide a verbal update for the 18th of November meeting, if you'd wish to do that, please.
Yeah, well, I'll cover both meetings as far as I'm able, and unfortunately I wasn't able to attend all of the latter meeting.
That's absolutely fine. Thank you so much for clarifying that. But we do actually, we do actually really want to welcome you on behalf of another matter, in your capacity as chair of the Budget Scrutiny Working Group, which there are a couple, which has a couple of members with Overview and Scrutiny Committee, since it forms part of our committee work. So the Budget Scrutiny Working Group meet around 4 times a year to independently scrutinise the financial planning process and the budget development. We actually met last week to consider interim budget proposals for the financial year of 2026 to 2027, which are currently out for public consultation. So since this is being live streamed, if any members of the public are interested in how we set our budget and if they have any ideas for things that we can draw into that, they're obviously massively appreciated and welcomed. We really love seeing that kind of democratic engagement. So we would like to extend an invitation for you to do that if you so choose. If it's possible for Councillor Bamford to talk to us a little bit about the work of Budget Scrutiny Working Group in the past year and, you know, in particular relation to coming up to our annual budget setting. We have been sent a document about it, which forms part of our preparation pack for tonight. But Councillor Bamford, if you'd be okay to take us through that, please, it'd be very welcome. Thank you.
So shall I start with the HOSC meetings?
Yeah, it's probably just about to do that. Sorry.
Take one thing at a time.
If we
That's
start
all
with
right.
HOSC and then go to budget scrutiny, that would be lovely. Thank you.
Yeah, but actually, fortuitously, there's three of the relatively small committee are here tonight, and I think probably between the three of us, we contributed 95% of what was said. So I'm hoping it will be a reasonably joint feedback on that, if that's appropriate. Anyway, I'll start with HOSC, if that's all right. So, and I think you've got the report that I wrote for your November meeting, which of course didn't happen, did it? So this is the first time I think that you've seen this. The first item that we talked about was the ambulance service, which, as I expect you're aware, for the last couple of winters has been in something of a crisis, partly because of queuing ambulances outside Gloucester Royal and to some extent Cheltenham General. So partly as a result of the rest of the health world, but also partly down to the fact that you know, their response times were well below expectations. So on the positive side, those response times have significantly improved so far this year. And that's, I haven't actually reflected that here, but that is probably the most important bit of feedback, with the exception of the more rural areas. Now, obviously, our county is not exactly it's more rural than the vast majority, and those expected response times are based on national averages. So you would perhaps expect us to be a little bit outside those values. But certainly at HOSC, and those of you that know Paul Hodgkinson and where he's based, it is something that comes up very frequently there. And I think it is a real issue for people living out in Bourton on the Water, and you know, that those response times are something that we wouldn't want. However, clearly you can't have a full fleet of ambulances stationed in every small village around the Cotswolds. So the update, which is an interesting one because it's certainly something I hadn't come across, was that apparently there is now a network of community first responders. And this is local people who aren't necessarily medically trained, but who have undergone training courses, who are able to provide a first response much more quickly than if it were left to the mainstream ambulances or even the rapid response guys in the single car. So I was really taken with that. I thought perhaps I would go on the website and see if I could actually, train up. No, I didn't do that. But I would encourage people, particularly those living out a bit. It seems like a really good thing to do, and you don't need any you don't need to be trained as a doctor, a nurse, or anything else. So, and it feels to me like a particularly valuable community service. Apparently, it used to be that we had fire co-responders. I don't know. Again, this wasn't something I was familiar with, but those numbers have significantly fallen off, and they were paid. But I suppose the thought from the ambulance perspective was that they weren't really getting value for money there, so those numbers have fallen away. But this service, which is essentially a voluntary one, is there to replace it. It's a bit like the RNLI, isn't it? Anyway, that's that side of things. Second item that we considered in October was the winter plan. Well, we've had most of the winter now, so we can judge how successful or not. Actually, there hasn't been any major hiatuses. Hiati? I don't know. Anyway, that. The Opal level today, for instance, is 4, so that means we need to get 100+ patients out of hospital every day to balance the books, as it were. So that's a big ask. So it doesn't mean that everything's calm, but it's not as bad as it has been in other years. However, as we speak, there are 130 patients in the acute hospitals with discharge-ready dates, or past their discharge-ready date. That means that the reality is they're probably deteriorating in hospital, because hospital is not a great environment unless you're being actively treated. So because there is nowhere for them to go in the community, or there's insufficient relative support or whatever, 130 patients. Now that's over 4 wards worth of patients. That's a hell of a thing. And because we talk a lot about the flu and norovirus and the like, but you've typically only got 30 or 40 people in hospital with that as the main problem. So that's, if you look at the scale of those two, the differential, maybe we're over fretting about the wrong thing. Anyway, more perhaps political interest is the maternity service. That's more of a political hot potato, I think. Where are we with that? Well, the only thing that I'm actually aware of in terms of figures that we've got was the Acute Trust did a patient satisfaction survey, basically, in response to some very bad press that it's been having. I'll come on to that in a minute. But it did pretty well, actually. This was carried out by all the acute trusts in the maternity providing services, acute trust services in the country. And we got 163 responses, and on the labour and birth service, they received a rating of 9.0 out of 10, which was significantly better than other trusts. On the staff caring for you, they got 8.9 out of 10, which was better than expected, better than average for acute trusts. And in care in hospital after birth, 8 out of 10, which was kind of middle of the pack. So I think when we're listening to all the very bad things about the service, I think the problem is if you've got between 6,000 and 7,000 births a year, people will have bad experiences, and the way that is portrayed, inevitably, I could criticise the press, but it's almost inevitable that they will focus on a small number of cases. Indeed, the maternity deaths thing that has led to all sorts of problems. Actually, those figures are statistically we're not an outlier, but yet it's generated a huge amount of noise. I suppose that's just the nature of life at the moment. But I think it's worth reflecting that with a bigger sample here, actually the patient experience is relatively positive in our hospitals. And on the upside also, we have got a lot more midwife in post. There was a significant shortfall in midwife numbers, which is no longer the case. So, the question then is, well, why not get Avita back open for births and also provide the full service at Stroud? And the explanation we have been given for that is that, first of all, is the national review, which I suspect most of you have heard about, that has focused on, I think, 16 trusts, is happening in the hospitals at the moment, and that will be reporting in March. And until such time as that reports, I think making a substantial change is felt to be unwise. Whether that, you can take whatever you like as well. That's reasonable, but that's it seems to be not totally unreasonable position. And the other big change is, which staggers me when I actually saw these figures, we've now got over 50% of people having caesareans. Well, I was astounded by that figure, because I can remember that when my daughter was born via caesarean section, it was about 1 in 7, 1 in 8. So that's and she's 25. So that is it. Well, it is true that we have an aging group of birth mothers, so I suppose that's part of the reason. But is it medical practice? Is it more defensive medical practice? Possibly. Is it actually that people are electing? I don't know. Anyway, that has placed a significant burden on the service, because those interventional births are clearly more staff consumptive, and not just midwives as well. We're talking about consultant surgeons, anaesthetists, and so on. So it's a more complex service. So that's why we are where we are with that service. Clearly, on HOSC, we want to get Avita back open as quick as possible. So I think we'll continue to ask questions about that.
Thank you so much, Councillor Bamford. That's really comprehensive.
Yeah. Sorry, Karen, it's all right. You can ask questions if you like.
I mean, I'm genuinely really excited to see the especially the Gloucester City Dental Access Centre as well, because this is something that's come into ONS before, and just seeing us making progress on that. That one item particularly, it just feels very validating to have that. I was just wondering, do any members have any questions about HOSC, or like based on last year? Councillor Horde, if you'd like to go ahead.
Just first of all, feedback on the community.
Councillor Bamford, would you mind just switching off your microphone? Thank you so much.
First feedback on the community first responders plan. I mean, it sounds quite a good idea, but potentially a bit alarming to have untrained medical volunteers being the first on scene in what could be, potentially life-threatening situations. Presumably, the only way they would know about the life-threatening situation is if they're being used via the 999 service, unless this is sort of people who just happen to be on the scene at the time. In which case, there is obviously the worry that these might become a substitute for proper response times from cars or ambulances. So I hope you will be pressing that point, and that we won't see a trend towards these untrained volunteers being substitutes for medically trained first responders. So that's question number one. Maybe you should answer them as you go along.
Take that one. So as you say, it's triage through the 999 process. So that it's clearly, if it's somebody in that you will still get the ambulance there as quickly as you would have done otherwise, I think is the point. So it's simply that it's an extra service, which means that people in rural communities are at least getting somebody with some basic skills, whereas they would otherwise be waiting for an ambulance for a longer period of time without anybody assistant. That's the theory. We haven't seen any figures to back that up, and I take your point that it could it could be used as a substitute. But in terms of the response times, we are still seeing the response times for the actual ambulance itself rather than the community first responder.
Okay, thank you. Second question was about the imminent reorganisation and really drastic financial cuts to the ICB itself, and whether HOSC heard any updates on that, and whether there are any implications for commissioning or delivery of services in Cheltenham.
The ICB staff reporting back to us didn't give us cause for alarm. I could take two views on this. One, that it is a massive change, and there will be a disturbance to the service. There are certain aspects that only come through the ICB, which I would think we would need to keep our eye on. The other side of it is that part of the organisation, the non-GP frontline acute services, health and community trust services, has grown a lot. And if there are to be cuts in the health world, I personally feel it sits more easily in that. Now, obviously, it'd be great to have everything, but nevertheless, the HOSC role really is to monitor the change. And as yet, I don't feel we've even scratched the surface, frankly.
Okay, only two more. Next one was on maternity, where, I'm very pleased to hear that you're sort of on the ball on this, because it seems to me disgraceful that now that they've actually recruited enough midwives and have got this new influx of new midwives, that the original reason for closing Aviva back in 2022, back in 2022 was shortage of midwives. So if we don't have that shortage, I think they should plan to reopen it as soon as possible. And using a national review as an excuse is, I think, pretty disgraceful. And it's not a major change to go back to what you're supposed to be doing in the first place.
I think we have slightly different views about health service provision, and particularly the split between sites in a amalgamated world where Cheltenham General has effectively merged with Gloucester Royal, and whether or not you can provide replicated services across clearly you can't across the board, but we're more and more in a situation where there is a differentiation between the two sites. And I think that's part of this problem here now, that Gloucester Royal has become the site where the most acute provision is made, whether that's intensive care, whatever. I worked in Cheltenham General, as you know, for 40 years. I couldn't be more pro Cheltenham General, but that's the reality of the health world that we're facing now. I think, and I'm not sure that that's completely the reason why the maternity services is as it is at the moment. I think it's part of that reason that it's a safety issue. That at the moment the clinical view is that the safest service can be provided without reopening Avita. And you mentioned the recruitment. It is true that the numbers are returned, and that was the excuse, if you like, that was given. So you could say, well, come on. But it is fair to say that those will be relatively inexperienced midwives. And the point about the more complicated birthing arrangements with caesareans, and with other birthing interventions, that's 3-4 years ago now. So it has changed. And so anyway, we with HOSC, we will continue to ask the questions, and I think that's all we can do.
Yes, do keep asking the questions, because actually a decision to permanently close it would be a major change on which they're statutorily obliged to launch a full public consultation, which has so far been avoided. And I'd just say that if since my son was born in a bit of a hurry, if there hadn't been a maternity unit in Cheltenham, he'd probably been born on the A40. So at times, distance and time matters, not just the configuration of services for the convenience of the trust. Anyway, and my last question is really about GP surgeries. RMP, as you know, is campaigning hard for an extra GP surgery for Cheltenham. And I have to say, I strongly support that, coming from the south of Cheltenham, where I'm getting more and more reports of people being unable to obtain an appointment. It's not because of shortage of staff, it's because of the pressure of demand, which you've described in your report very well. But we have, certainly in Leckhampton, we've got over 400 new homes coming to the immediate area already, and potentially thousands more if the strategic and local plan does what it's planning to do south of Up Haverley Way. And so there are very, very real concerns now about people being able to get access to primary care. So is there any progress on getting another GP surgery?
Well, I think we can agree on this one, Martin. Yeah, I mean, clearly the service has changed out of all recognition. There are 400,000 appointments a month now, which is, as far as I can see, that means that every single man, woman, boy, child, member of the population sees the GP on average 8 times a year. Well, I don't know about, I mean, I'm lucky if I see him 8 times in a lifetime. So some people are seeing, this is direct consultations, can be over the phone, but it is a consultation with a medical practitioner. You're not one of the practice nurses or anything like that. It's 400,000. So clearly, that number is hugely moved on in the last 20 years. So, and the expansion of the service has not moved quickly enough to cope with that, I don't think. So, which is why you're getting huge wait times for GPs, and that I think has a knock-on effect through the health world as well. Because there's an awful lot of people pitching up at A&E at the moment, with sore throats, with cut fingers. And that puts pressure on the. Whilst I know you've got different flows in A&E, that still creates a pressure in that system. And if we could get access to GPs in the way that, well, I can remember not all that long ago. I think a lot of that pressure would be diluted. So yes, we fully support Max's campaign. Desperately need at least one new surgery in Cheltenham.
Thank you so much for that, and thank you for your questions, Councillor Horde. I really appreciate it. If we have any further questions about the HOSC committee that Councillor Bamford can raise, if you're happy to email them to Democratic Services and we can liaise as a focal point, I think that would be really productive, just because again it's a very wide subject matter, and this has been a really excellent summary. We just want to make sure that we learn more about it and that we keep our engagement really well with this. It's something that our constituents ask us about a lot. We massively appreciate being able to input about it and learn about it as we go along. So thank you so much, Councillor Bamford. It's really useful getting your insights on this. Is it okay to move across to your ideas about budget scrutiny working group? We don't have too much time allocated left in our meeting, so if you're able to give us a relatively swift overview, that would probably be really useful, if you don't mind, please.
Okay, well, as I said, if Chris or Pete want to come with anything I'm saying, you've probably got as much ability to feedback back on this as I have, but I'll try and. I think have you got this report? Was this sent round?
Just the minutes from the meeting.
Kind of, yes.
I only have documents and minutes.
Okay, right. So in that case, obviously the feedback will be a little bit longer than otherwise. I think I ought to just explain what I imagined at budget scrutiny. We'd be looking at the budget on a sort of line-by-line basis, i.e., oh, look, the refuse collection salaries are more than we thought they were going to be. Why is that? Member of the finance team. the income on Sems and Krems is down. But we don't do that. It isn't about a line by line look. It is much more of a strategic overview. In fact, the report we got was exactly the same as the one the Cabinet got. So we haven't scrutinised it in greater detail than the Cabinet would have done. So I think it's worth making that point, if that's okay. So what did we conclude? Well, the budget situation, I think Pete mentioned about the fact that the timing for the settlement meant that, you know, the time frame was extremely compressed. In the time available to come up with a clear plan for how the gap that emerges every year, you know, we set the budget, we look at our income, there's a gap which a savings plan has to fill. All that was available to be done in that couple of weeks was firm up those income and expenditure figures and have a look and find out what the gap was, not to come up with the £1.1 million worth of savings that we knew would fill. However, you know, savings plans they come forward every year, and there will be one for this year, but we the group didn't have a look at that. No doubt we will when it emerges. That is kind of the key thing, in a sense that, you know, all the services that we are providing now, we will continue to provide into the future. There are a few growth items as well built in, so all of that's good. Our financial position is better than 90% of local government, so we ought to be pleased about that. It's not, you know, it isn't ideal. We'd like not to have a savings plan at all. We'd like to be able to just carry on and, yeah, so there's that side of things. It's also the level of balances. There's a guideline level of balances which, you know, we've not quite been able to reach, and I guess that's the level of uncertainty that we're dealing with at the moment. That we need this. We need a full savings plan to deliver the balances and carry on as providing all the services which we are doing. That is the budget plan. Is that we will do that, and that's what we were scrutinising, and, you know, we're very happy with that. The other side of things is that there are a number of earmarked reserves which could also help us to some extent in this process, and they will be looked at through this process. I think we'll be meeting again before it goes to council, we think, not 100% certain, but if that's the case, obviously we'll be in a much better position to tick off things like the savings plan. I could read this, the rest of you. Do you want me to read it? Okay. Okay, here we go. This is only initial feedback, as key savings are fundamental to the budget. It has not been possible for the working group to review these fully, as only a draft has been provided. This means it has not been possible for members to fully scrutinise the budget proposal. The timing of the government settlement makes it very difficult for full scrutiny activities to take place, and for the Budget Scrutiny Working Group to fulfil their duty. The time frame of the final budget report is being reviewed to see if it's possible for the working group to meet again prior to Council on 27th February. If that is not possible, members will be able to share their feedback directly with the Council meeting. We had a productive and positive discussion with the Chief Executive and the Cabinet Member for Finance and Assets. Indeed we did. Which highlighted areas of concern to ensure decisions will be considered with these in mind. The importance of assessing deliverability of plans was also stressed. I think that's the savings plan fundamentally. We are confident that the leadership are are committed to deliver their corporate priorities for residents and continuing to deliver excellent services as we move into LGR. General balances, savings, borrowing and capital receipts will all need to fall in line to deliver these corporate priorities. Yeah, I didn't talk about the capital side of things, but in fact, we didn't go. Do you think we went into much detail on the capital side? Go on, yeah.
Hi, just 'cause I'm a member of Budget Scrutiny, so I was at the meeting. Well, we didn't, but I think there's a good reason for that, which is the capital expenditure is going to change. And so we weren't looking at the final figures.
And the problem with that is obviously borrowing levels that therefore change and interest charges within the budget. So it's complicated, right? But we're not. The point being that we're not in a position at where whatever date it was, 5th of January, to finalise that. There are areas of concern around the detail and assessment of deliverability of the savings targets and how savings gaps will be filled. The assessment of the commerciality of assets will be key. Did we say that? Apparently, yeah. Clarity around savings was also highlighted in the recent peer review. Finally, over the last 2 years, there have been targets to increase the levels of general balances which have not been achieved. It is important that there are clear plans to ensure general balances reach the levels set out in the S151 report. Thank you.
Thank you so much for that, Councillor Bamford. Do we have any questions from the committee? Mrs. Young, thank you so much.
Yeah, I have two questions for the working group to consider. On Appendix 2 of the budget proposal, the figure shows an increase of nearly 80% within the Chief Executive Directorate. I hope my calculation is correct. Yeah. Could I ask for some clarification of what is driving that rise? Yeah, for example, is it related mainly to staffing or other specific areas? For the Appendix 7, which is provisional fees and charges, well, I may be looking a little details. Yeah, I saw that there's some items regarding the street trading consent, and I saw that while the full year charge for the hot food units is included, however, the half year, quarterly, and monthly rate seems to be missing. So I'm not sure whether that's intentional or not, or I have overlooked something in the document, because I'm wondering those charges not being offered might discourage the street trading overall. Thank you. The first one is Appendix 2, and then the second question is related to Appendix 7. Yeah. I saw the increase of nearly 80% within the Chief Executive Directorate. So I just want to know what is driving that rise.
I mean, Councillor Jeffries, would you be in a position to answer that? Because that may be slightly more your purview.
Can you turn your microphone off, Margaret, please?
So thank you. Because that's in Appendix 2, isn't it? The executive. Yeah, Councillor Jeffries, if you're okay.
Thank you. I'd be delighted to answer that question because it was specifically asked. We were having a conversation about it prior to me walking into the budget scrutiny meeting, but I can't actually find the figure we were discussing, which left me with the right answer to give you. So I'm going to have to come back with some detail at another time, if that's okay, because I'm looking down the column of the spreadsheet and not being a spreadsheet person. It does balance out elsewhere. It just looks like an anomaly because I raised the question with officers saying, hang on a minute, you can't just add another £2 million in that particular area. And there was a rationale and some figures behind that. So if I can get the detail for you, and probably on the other question as well, because that's a very specific line. So I'm happy to provide that information if I can get the actual wording of the question from DSU. Is that okay? Thank you.
It's absolutely fine. We'll clear that up and then we can circulate your answer around the entire committee. So that works for everyone. And do we have any further questions as well for Councillor Jeffries or Councillor Bamford? Councillor Day, go ahead, and then Councillor Chelling.
Thanks. Well, it's not really a question. I was just going to, because I was at the meeting, and I think, we were looking very much at a work in progress, but that's not the fault of the council or the finance team. It's really driven by the central government being very late in the day, saying what our funding will be from central government. And I think as well, it's very disappointing that the current government has continued the very unfortunate attitude of the previous government of not funding the things that people, voters, residents actually care about and see day to day in their community. And that has put this council, they were a better place than a lot of other councils, along with a lot of other councils, in a really difficult position in needing to work out how we fill, this budget gap between now and the budget being approved. And really, a lot of that is down to central government just not funding adequately the things that people actually want them to fund.
Councillor Chen, go ahead.
Thank you. This is slightly left field, I suppose, but in section 7.3 of the document, it says the consultation on the local government provisional finance settlement sets out 7 questions which it is asking councils to consider. And they're all sort of yes-no questions. They're all leading questions. And I just wondered to what extent we're obliged to answer those. Do you agree or disagree with X, Y, Z? Because I just thought, that's probably a lot of work to be answering those. And is that just speculative or is that required?
I asked if the budget scrutiny group had any role in this, and it was indicated to me that we didn't. They provide.
I think the trick there is to consider. So they're suggestive questions by central government, and obviously then we can tailor our questions to suit us locally. That helps.
Go ahead if you've got further questions.
As the budget's out for consultation at the moment, I am quite interested to know what kind of responses people submit to something like that. Are they quite detailed about, oh, this charge has gone up, or massive macro stuff? Just what sort of responses do people provide to a consultation on the budget?
Oh, historically, we've had past political responses from other political parties. Like you say, some very macro questions, which might be quite personal to that particular person, and for whatever reason that might be. So we get quite a broad spectrum, and that can vary year to year. So yeah, you can have a full slate of responses to everything. More often than not, a political party will do that. It may not be from the political party. I'm trying to think. I think it was a couple of years ago. I think we had the Labour Party response, which was quite nice to see. So yeah, it can vary, and be, like I say, right down to the micro, just a particular question. But we'll see what the responses come back this year from the consultation.
Do any councillors have any further questions regarding this? Are we all good? Okay. Do you have any? Oh, Councillor Bamford.
Yeah, on the Chief Executive Directorate, the budget is based on the establishment for this year and anything that's been agreed within council. So I agree the figure looks odd, but it is not. There's no growth in there. Which is, I think, the point that Gareth made to us.
Okay. So I guess that kind of summarises. I think Budget Scrutiny Working Group is still going to have some capacity to look at this ahead of time, but if anyone else has any further questions about it. Councillor Jeffries, did you want to make a comment?
Thank you, Chair. It must be incredibly frustrating for Budget Scrutiny, and I empathise entirely. I think Councillor Day summed it up that central government are just playing an unusual game when it comes to how residents expect, what they expect to see in their communities. It is a tricky one, and I will endeavour, and I said to the budget scrutiny group, I will endeavour to get that paperwork and much information to them as soon as I can. But unfortunately, we have got a lot of work to do within the finance team. This 3-year settlement has left off quite a few reviews to do. But as and when we can get information there, we will, if we can. Suffice to say, I think the intention by central government, not only to carry on with the previous government's underfunding, is quite clear in where they're going when it comes to the government review and how they see this ending up, because they may have moved money around in the country to other areas that have, got more money than others, and obviously we're having less. Overall, the funding for local district councils is quite considerably stark. So, yeah, I will endeavour to provide as much information as I can when I can to those colleagues. Thank you, Chair.
No, thank you so much. We really appreciate that. So I'll close that discussion for now. But again, oh yes, go ahead, please.
So I just wanted to check, you both mentioned about the gap between what the government is funding and what residents expect to see, and just someone who's not, been historically involved in that, it's a bit vague. So sort of what specifically is that gap looking like? Like residents expect to see this, this and this, but central gov is doing that.
I think residents expect, well, where we were 10 years ago. If you think you had 10 years of austerity, and this is basically a continuation of for Cheltenham, we've seen our budget shrink quite considerably. So this is effectively what I think Councillor was articulating was a continuation of that. So we've now got to find savings within our budgets to try and keep delivering the services as best we can. And clearly that puts a lot under pressure. So I think that's what Councillor Day was sort of articulating.
Can I just add there that if you think about it, we've got a budget of about 24 million. You've had a savings plan of about £1 million a year over 10 years. That's an awful big percentage of the budget. So I think we've done very well to provide.
Thank you so much. So yeah, thank you very much for Councillor Bamford, Councillor Jeffries, for coming in and consulting on that. We really appreciate it. We'll move on to the next item. It should just be item number 8 is updates from scrutiny task groups. We don't actually have any active at the moment. So again, if anyone has something to refer to us in that matter, in that capacity, then we're always happy to consider it. And you should have a copy of the ONS work plan for item number 9. So the next meeting will be focusing on the 2nd of March. We'll be looking at the update on the Golden Valley Social Value Strategy, as well as updates concerning the Culture Board to check their terms of reference and assess success against their TOR on that one. And we're also looking at the youth engagement policy, specifically being made by the No Child Left Behind project. So these, if you're okay to start having a little bit of a think about us Golden Valley Social Value Strategy, Culture Board and youth engagement policy ahead of next meeting, that would be really, really good, just to try and get started on it early. Does anyone have any comments about the work plan overall that you would like to bring into discussion now? Are we all good? Okay, but again, feel free to email Democratic Services outside the meeting. It's always really good to hear your views. Item number 10, any other item that the chair determines to be urgent? I feel like we've covered just about everything that we needed to today. And that just leaves for the date of next meeting on as item 11, which the next overview and scrutiny meeting will be on the 2nd of March 2026. So looking forward to seeing everyone there. Thank you so much for joining us tonight.